Hello everybody and welcome to this session of clinical discussion on facial nerve MCQs. I am Dr. Vyshnavo, your ENT faculty on the Unacademy platform, and today we are going to discuss facial nerve. So please give me a quick confirmation if the audio visual relay is fine. So if it is fine, we can begin with the class. So I think it's fine. So let us begin the class with the session today. So let me just tell you what we have on Unacademy. So on Unacademy we have multiple things. Yesterday we had examination and all India mock test, but that's already done. So we have something called as Unacademy Lite for NEET PG, which is only a practice based session. So you can practice tests over here. You can do subject wise test, you can do system wise test, you can do full length mock test, you can do previous year's question papers, and you can do test series which are given by educators. So this way you're covering all the subjects. Topic wise you're doing, system wise you're covering all the grand tests, you're doing PYQ. So if you are exclusively looking for a app that is going to help you practice the test, then this is what it is going to help you for. It's available on Android and web, so you can take this app and you can take up only the practice course. You don't have to take the theory sessions at all. We have prof examinations also being taught on Unacademy. So we have the prof 1 coming up. So it is a path towards your MBBS and next. The first batch is starting from April 20th. So you can use the code ENT live to get an additional 10% off. So these are the pre-launch prices which have been very competitive, and if you want to get another 10% off, you can use the code ENT live. We are launching auto daily practice papers, which is a very important concept, that when you have done a theory session with the educator, immediately you will have MCQ discussion or MCQ solving sessions over there, so that your concepts are reinforced and you're able to understand things well. You're understanding and also practicing. So there is a difference between understanding and implementation of what you've understood. So practice also happens then and there. So these questions are handpicked by the educators. They are topic wise, concept wise questions which are available. So Plus subscription offers you all of this, where you can access live and recorded classes from the top educators and study from the device of your choice. You can choose Unacademy and Prep Ladder together, which is called as iconic subscription. We are very proud of our toppers. So this special class feature has a raise a hand feature, which is a very interactive feature which allows you to talk to educator in real time and understand what you want to get from the educator out, or if you're having a doubt, if you want to talk something, you can do that in the class itself without having to wait. We have a high yield revision batch and an MCQ batch for FMG, which is starting from April 13th to May 13th, which is a 1-month batch course. And we have a NEET PG high yield theory batch, which is also starting from April 13th to May 13th. So this is also a 1-month batch course. We have something called as an exclusive doubt clarification batch, where we are not discussing anything. It will be exclusive subject wise doubt clarification for all the 19 subjects, and you will have the solve the doubts from the top educators who will help you become exam ready. So if you've got a list of doubts together when you're attending the class, we will make sure that all the doubts are cleared at one go, and you don't have to run around errands to get your doubts cleared. NEET PG subscription also is available as only Plus or iconic or light subscription. For any of which, please use the code ENT live and you will get another 10% off on the subscription price. So with this, let's begin the class. Hello Madhusudan. A 50-year-old man presents with a 3-day history of right-sided facial droop, ear pain and increased sensitivity to sounds. The general examination reveals multiple vesicles in the right external auditory meatus. Which of the following is most likely reason for his increased sensitivity to noises? Paralysis of the stapedius muscle, paralysis of the chorda tympani branch of the facial nerve, paralysis of the greater petrosal branch of the facial nerve, paralysis of the nervus intermedius branch of the facial nerve. So please type your answers in the chat box below. I'm waiting for your answers in the chat box. So Roma Chavan says 1. So when they're telling you that there is a history of facial palsy and there is vesicles in the right external auditory canal with increased sensitivity to noises. Yeah, so the right answer is stapedius muscle, which is paralyzed. So the clinical history is suggesting to you that there is a right-sided facial palsy, increased sensitivity to sounds and vesicles, which is suggestive of probably a viral condition, which is Ramsey-Hunt syndrome. So in Ramsey-Hunt syndrome or herpes zoster oticus, you will have the herpes zoster virus which remains latent in the geniculate ganglion, and when it remains latent in the geniculate ganglion and whenever there is a reactivation, it is associated with 7th nerve palsy, 8th nerve involvement and vesicles in the area of distribution of facial nerve. Now obviously when there is a 7th nerve palsy and there is a lesion at the geniculate ganglion, the nerves which come distal to that are impaired in their function. So the nerve which comes below it is the nerve to stapedius, and when there is paralysis of the stapedius muscle, it will not contract. When it doesn't contract, the stapes becomes hypermobile. This hypermobility will allow excessive sound waves to enter from the middle ear to inner ear, making the patient sensitive to noise. So paralysis of the stapedius muscle is the cause for increased sensitivity to noise. So I hope all of you got the answer, which is paralysis of stapedius muscle. Paralysis of the chorda tympani would present with taste disturbances or loss of taste sensation. Greater superficial petrosal nerve would result in decreased lacrimation, and nervus intermedius is the sensory root of the facial nerve or the nerve of Rysberg, which supplies the skin of the concha and the posterior canal wall. So you will have loss of sensation over the skin over the concha, and that sign is called as Hitzelberger sign. So here the correct answer is paralysis of the stapedius muscle. Let us go to the next question. A 25-year-old musician presents with a difficulty in blowing the trumpet and chewing the food as well, and the food is getting collected inside the left cheek. Further questioning reveals a history of recent fall onto a concrete slab, hitting his head, following a brief period of loss of consciousness. Which of the following is the most likely underlying cause of his symptoms? Subdural hemorrhage on the left side, subarachnoid hemorrhage on the right side, muscle weakness as a result of temporal bone fracture, left stylohyoid muscle weakness as a result of damage to the cranial nerve. So please answer in the chat box, what do you think is the right answer? So they are telling you that the patient is difficulty in blowing the trumpet, food is getting collected inside the cheek, left cheek, history of fall is there. So which is the likely cause for these symptoms? Now whenever there is a trauma, obviously you can have a subdural hemorrhage, subarachnoid hemorrhage, muscle weakness, or you can have stylohyoid muscle weakness also because of cranial nerve injuries. But here they are telling you two situations where the patient is failing to blow the trumpet, which means the buccinator muscle or the orbicularis oris muscle, which is responsible for blowing, is not functioning well. And why is it not functioning well? Because of the nerve that is involved in the time of fall. So which nerve supplies the most of the motor muscles of the facial of the face or the facial muscles? It is the facial nerve. And do we know facial nerve travels through the temporal bone, and it travels through the petrous bone, tympanic bone, mastoid bone, and exits out? So when there is a temporal bone fracture, can there be a possibility of facial nerve injury? Very high possibility. And in that situation, the muscles supplied by the facial nerve become weak, and that can result in deviation of angle of mouth, loss of ability to close the eyes, decreased tearing resulting in corneal ulceration, inability to blow the cheek, in asymmetric smiling, difficulty in chewing, as a result the food gets collected over there. So all these are symptoms of a muscle weakness because of a temporal bone fracture, and this is the correct answer. Let's go to the next question. A 35-year-old woman presents to the hospital with a 3-day history of inability to close the right eye and a right facial droop. Further history reveals that she also experienced discomfort behind the right ear and a mild headache. The neurological examination reveals features of right-sided facial muscle weakness. Which of the following best explains the inability to close the right eye? Bell's palsy with involvement of the chorda tympani nerve, Bell's palsy with damage to the greater petrosal nerve, Bell's palsy with weakness of the orbicularis oculi muscle, weakness of the frontalis muscle due to stroke in the pons. So I am waiting for your answers. Yes, very good. This is a very simple question, although it looks like a very big question, and the first sight of it you get usually, you get a little panicky thinking that it's such a big question, will I get the right answer? So most often even such big questions can have very simple answers, like you can see here. The only question is, what is the reason for a patient to have inability to close the right eye when there is a right facial palsy or a facial palsy? Often it is because of the weakness of the orbicularis oculi muscle that will result in inability to close the eye. So orbicularis oculi is responsible for eye closure. So it is, if there is a weakness because of the incomplete supply from the facial nerve, it will result in inability to close the eye. So that was a pretty simple question. Let's go to the next one. A 35-year-old man presents with a temporal bone fracture after falling off from a motorcycle without a helmet. On examination, the patient has a facial weakness. He is not bothered by the resulting slight asymmetry in his smile. However, he has noticed increased nasal crusting since his accident. Where was the lesion of the facial nerve, or where is the most likely the facial nerve has got damaged? Mastoid segment, labyrinthine segment, geniculate ganglion region, chorda tympani segment. So I will cut this and I will make this parotid segment. Yeah, now you answer this question. So I am waiting for your answers in the chat box. So Roma, Daisy Duck say 3. Naveen also says 3. What about others? Okay. So here they are telling to you there is a history of temporal bone fracture, but the patient is having increased nasal crusting. Now how is crusting associated with facial nerve? Let us understand. Now if from the first genu of the facial nerve, you have a nerve that comes. This nerve is called as greater superficial petrosal nerve. This greater superficial petrosal nerve joins the deep petrosal nerve, and these two nerves together will form nerve of the pterygoid canal. So this nerve of the pterygoid canal is nothing but your Vedian nerve. So this median nerve is responsible for autonomic innervation of the nasal cavity. So if there is a disruption of the GSPN, autonomic innervation to the nose gets disturbed. As a result, the mucus glands which get supply are not receiving adequate supply, and as a result there is decreased mucus production in the nose. This decreased mucus production leads to dry air currents going in and coming out, resulting in increased nasal crusting. So autonomic innervation in the nose is getting disturbed because the GSPN is not functioning. So probable lesion now here would be at the level of first genu or geniculate ganglion. So the answer is first genu or geniculate ganglion. So I hope all of you got the answer for this question. So this is an indirect question, not a direct sort of a question. A 34-year-old man presents to the emergency department with several facial lacerations and had multiple head injuries after being involved in a fight. He had an obvious left-sided facial weakness. Stapedial reflex and lacrimation both are intact. However, there is a impairment of taste sensation in the anterior 2/3 of the tongue. Where is the lesion located? Labyrinthine segment, tympanic segment, mastoid segment, extratemporal segment. So please answer. Meanwhile, I am drawing something for you. So Samir is saying 3. Roma is saying 3. What about others? Okay, so the correct answer is 3, which is the vertical segment or mastoid segment. So they have told you that the stapedial reflex is good, lacrimation is good, which means that these two nerves are functioning and there is no lesion at these levels. So the lesion is beyond the nerve to stapedius, which is nothing but the vertical segment, which we call it as the mastoid segment of the facial nerve. Labyrinthine segment would result in loss of GSPN and stapedial reflex. Tympanic segment would spare this lacrimation, but mastoid segment will spare the nerve to stapedius as well as GSPN. So the answer for this is mastoid segment of the facial nerve. So I think you all got it right. So I am sure that all of you know the explanation as well. A 45-year-old woman presents with vesicular rash in the right ear with facial pain and a facial droop. Symptoms began 2 days ago with the rash developing in the morning. The condition is associated with reactivation of varicella zoster virus along which ganglion? Cervical ganglion, geniculate ganglion, otic ganglion, trigeminal ganglion. So Samir is saying 4. What about others? Roma is saying 2. Yes, so the correct answer is 2. So Ramsey-Hunt syndrome varicella is caused by varicella zoster virus or herpes zoster virus. This remains latent in the geniculate ganglion, which is nothing but the first genu of the facial nerve. Whenever the patient's immunity drops down or whenever there is an immunosuppression, there is reactivation of virus, and when there is a reactivation of virus, it will begin with vesicular rash, facial pain, facial palsy, 8th nerve involvement resulting in sensory neural hearing loss. So the ganglion which is associated with herpes zoster oticus or varicella zoster virus is your geniculate ganglion. A 14-year-old male patient is undergoing right parotidectomy for an adenocarcinoma of the parotid. During the surgery, it is found that his facial nerve is involved by the tumor. A decision is made to sacrifice the facial nerve. Which of the following nerves is used as an interposition graft for facial nerve reconstruction during parotidectomy? Greater auricular nerve, posterior auricular nerve, auriculotympanic nerve, auricular branch of the vagus nerve. So I am waiting for your answers. So whenever you resect a nerve, now obviously you have removed this much portion of the nerve because it was engrossed or engulfed by a tumor. Now you need something to interpose between the two cut ends of the nerves. So you need an interposition graft. So you need something called as an interposition graft. So this interposition graft is usually the greater auricular nerve because it can be harvested from the same site. So a greater auricular nerve can be harvested from the same incision site that you have made, slightly extending it inferiorly, and once you harvest it, you can interpose between the two cut ends of the nerve which have been involved in the tumor. So the answer is greater auricular nerve. Now syndromes associated with facial nerve are all except Millard-Gubler syndrome, Melkerson-Rosenthal syndrome, van der Hoof syndrome, Ramsey-Hunt syndrome. So Samir, now when we do meanwhile others can answer this question. Now when we do a mastoid surgery or a middle ear surgery, we take a incision like this. Now if we are doing a parotid surgery, we take a lazy S incision like this. So here itself we have the greater auricular nerve which is supplying the lower half of the pinna and lower half of the skin below the pinna. So obviously when I am doing a parotid surgery or a mastoid surgery, if the facial nerve gets resected, the two ends of the nerve has to be re-anastomosed. So the anastomosing nerve which is connecting the two ends, cut ends of the facial nerve, will be the greater auricular nerve because it is present at the same site where you have made the incision, whether it is parotid surgery or whether it is mastoid or middle ear surgery. So have you got it, Samir? Okay, so I think the next question, syndromes associated with facial nerve are all except, the answer is van der Hoof syndrome. That is the right answer. Millard-Gubler syndrome is seen whenever there is a lesion in the pons. So whenever there is a pontine stroke, there is sixth nerve involvement, seventh nerve involvement and a contralateral hemiplegia which is called as a Miller-Gubler syndrome. Melkerson-Rosenthal syndrome is facial nerve palsy, swelling of the lips and fissure tongue, and we just discussed the Ramsey-Hunt syndrome. All are true about Ramsey-Hunt syndrome except it has a viral etiology, associated with 7th nerve, associated with 8th nerve, results of spontaneous recovery is good. So all of them are true except. So which is the except? So Naveen says 3. What about others? Okay, so Ramsey-Hunt syndrome is nothing but herpes zoster oticus or varicella zoster oticus. This is caused by viral etiology is true. 7th nerve and 8th nerve involvement is true. Results of spontaneous recovery is bad. It is not good. But results for spontaneous recovery is good for Bell's palsy. It is not good for Ramsey-Hunt syndrome. It is good for Bell's palsy. For Ramsey-Hunt syndrome, it is bad. So the answer is option 4. Facial nerve stimulation during testing of the nerve is indicated by contraction of which muscle? Temporalis, masseter, sternocleidomastoid, orbicularis oris. So I am waiting for your response. Yeah. So the correct answer is orbicularis oris. So whenever we talk of facial nerve stimulation, we talk something about electroneuronography or electromyography. So when we give electrical stimulation, we see contraction of the muscles. So electroneuronography and electromyography are the electrophysiological tests. So the muscles where we give stimulation and see a response for is either the orbicularis oculi or the orbicularis oris. So facial nerve stimulation is identified by causing contraction of the orbicularis oris muscle. So with this I finish my session, a short session for facial nerve MCQs. So I hope you guys enjoyed solving these questions with me, and if you want to have more of these sessions or have idea of different MCQs, you can log into my special classes, which are free classes. So to log in into the special classes, you can use the code ENT Live, and to subscribe for my plus classes, you can again use the same code ENT Live to get a 10% off on the subscription. Thank you very much.